bundles that's based on the infection control policy and the procedure and other guidelines. Our outline and objective to identify the most common type of healthcare associated infection that may be preventable, to define the care of bundle that related to invasive devices and surgical procedure, to discuss and review the most common practice care bundle that will help to prevent and control the infection. In general, healthcare associated infection are infection that patient can get it in the healthcare facility while receiving medical care up to 48 hours after hospital admission and up to 3 days after discharge and up to 30 days after an operation. Healthcare associated infections are one of the most common complications affecting patients in the hospital, as well as causing unnecessary pain and suffering for the patient and their family. They are responsible for increasing the rate of morbidity, mortality, and prolonged patient hospital stay and increased medical costs. As you know, there are many hospitalized patients need for these invasive devices and surgical procedure, but unfortunately, these devices and surgery put the patient in much higher risk of developing mechanical complication and infection like CLABSI, CAUTI, VAD, and SSI. So these four most common type of infection are serious, but can often be successfully treated. So healthcare workers, they can play an active role in healthcare associated infection prevention with the basic infection practice, like for example hand hygiene. So healthcare workers should and must follow and adhere to standardized protocol which incorporates infection prevention practice known as care bundle. So what the care bundle? Care bundles is a group or small set of evidence-based practice intervention, usually 3 to 5, for a patient who with, for example, Foley's catheter or central line, when implemented together will result in the patient's outcomes than when implemented individually. Central line, as you know, is used to administer and then enter into the bloodstream. It will cause CLABSI, central line associated bloodstream infection. CLABSI are among the most common and most serious type of healthcare associated infection. They are a major cause of mortality and morbidity, prolonged hospital stay, and increased medical costs. CLABSI diagnosed when there is a clinical sign of infection, fever more than 38, or chills, or hypotension. For neonatal less than 1 year, it will develop or their clinical sign of infection, fever 38, or hypothermia, or apnea, or bradycardia. Also diagnosed with a laboratory confirmed infection with a positive blood culture. What the care, CLABSI bundle or bundle for prevention of CLABSI? Hand washing, we should perform hand washing, use maximum barrier precaution, subclavian site selection, and chlorhexidine skin preparation, and daily assessment for necessity for continuing central line. The optimal site selection is recommended to use subclavian site rather than a jugular or a femoral site to minimize the infection risk for non-tunnel central line placement. Also recommended to always avoid femoral access unless no alternative. For hemodialysis patients, it's recommended to use a jugular or a femoral vein rather than subclavian vein to avoid stenosis if catheter access is needed. We should always weigh the risk and the benefit of the placing device at the recommended site to reduce infectious complication against the risk of the mechanical complications such as pneumothorax, subclavian artery puncture, and air embolism, and catheter misplacement. A surgical hand scalp or a surgical hand rub must be performed before insertion central line and when maintaining the catheter. Aseptic technique must be used for catheter insertion. Maximum sterile barrier. The operator and the assistants who are going to insert the central line and the sterile field, they should use maximum sterile barrier by wearing surgical mask, hair cover, sterile gown, and sterile gloves. And other staff who are not involved in this insertion and they are not in sterile field, they should wear surgical mask, head cover, gown, and perform hand hygiene appropriately. Also, we should use the sterile drips to fully cover the insertion area in the patient. Chlorhexidine 2% should be used for skin preparation, and if not available, use Profidine iodine. And ensure complete dryness barrier to incision. We should daily review the central line by assessing on a daily basis the continued need for central line, taking into account all the issue of the best patient practice, take on a daily basis that this has been done. Other basic prevention practice, central line dressing. We should use a straight, transparent, semi-membrable dressing to cover the insertion site, and we should record the date and time of catheter insertion in the obvious location near to catheter insertion site, for example, on the dressing, and we should record on the 24-hour patient progress note and on the plan of the care of ICU follow sheet. We should change the transparent dressing every 7 days, sooner if the dressing is not intact, and if there is no longer seal, and if there is evidence of inflammation. Before changing the dressing of central line, our hand must be decontaminated using alcohol hand rub, and sterile gloves should be used. Chlorhexidine product should be used for skin preparation before dressing. As you can see in the slide, this is the form, the one on the right. I think it's not clear, I do apologize. But this, there is a form, a central line insertion form, that when we insert the insertion for documentation, and also the other form for maintenance central line bundle and daily review for assessment. Urinary catheter, as you know, it's for our Foley catheter. It's used to empty the bladder when people have difficulty urinating naturally, and to empty the bladder before and after surgery, and to help perform certain tests. But what will happen when the bacteria got chance in the urinary tract through the Foley's catheter? It will cause CAUTI. CAUTI is catheter-associated urinary tract infection. Is defined as urinary tract infection in a patient with current urinary tract catheterization or who has been catheterized in the past 48 hours. CAUTI diagnosed when there is a clinical sign of infection, fever 38, more than 38, suprapubic tenderness, urinary urgency, urinary frequency, and dysuria, and with laboratory confirmed CAUTI from a positive urine culture. Bundle for prevention CAUTI: perform hand hygiene, avoid unnecessary urinary catheter, insert urinary catheter using aseptic technique, maintain urinary catheter based recommended guidelines, and review urinary catheter daily and remove immediately. So, perform hand hygiene is the first and the most preventative measure, and we should are recommended to avoid unnecessary urinary catheter by assessing the need for the catheterization, and must be inserted only when there is an indication. The catheter should be regularly reviewed and removed when it is no longer needed. Catheter should be inserted using aseptic technique and sterile equipment. Recommended guidelines for maintaining urinary catheter. We should check the catheter has been continuously connected to the drainage system. We should perform routine daily mental hygiene to decrease the bacterial colonization. We should keep catheter properly secure to prevent movement and urethral traction. We should keep collection bag below the level of the bladder all the time. And we should empty the collection bag regularly by using the separate urinal container. Our hand should be washed and a pair of the clean non-sterile gloves should be worn for catheter manipulation, and we should adequate catheter maintenance with every patient, every day, and every shift. Keeping Colles catheter in the place more than 48 hours put the patient at risk of infection. So it's very important to review the catheter regularly in order to be removed. This is the form, urinary catheter insertion form for documentation and maintenance bundle for daily review. Mechanical ventilator, as you know, is a machine that supports breathing for the patient to get the oxygen into their lung and to remove carbon dioxide from their body and to help the patient breathe easier and for patients who have lost all ability to breathe on their own. So what will happen when bacteria got infection? Bacteria get into the patient's lung through the ventilator equipment. It will cause ventilator-associated pneumonia. So the valve is a pneumonia that develops within 48 hours or longer after mechanical ventilation is given. It's leading cause of the death and high rate of associated mortality and prolonged time spent patient on ventilator and length of the stay of patient in the hospital and increased medical costs. Valve diagnosed when there is a clinical finding, fever more than 38 or less than 56, and when there is a WBC more than 12,000 cells per cubic millimeter or less than 4,000 cells per cubic millimeters, and also diagnosed through the X-ray when it shows abnormal, and with laboratory evidence of sputum positive culture. All of these are one of the best way of diagnosing the valve. Bundle for preventing valve, elevation the head of the bed from 30 to 45 degrees, daily sedation vacation, provides peptic ulcer disease prophylaxis, deep venous thrombosis prophylaxis, and daily oral care with chlorhexidine. Elevation the head of the bed, it will help to decrease the aspiration of gastrointestinal content, and it will help to decrease the risk of aspiration of oral pharyngeal and nasopharyngeal secretion and improve patient ventilation. Of course, this position, it's absolutely, there is a contraindication with this position, especially with the patient who has recent thoracic or lumbar surgery or spine surgery, injury, or unstable pelvic fracture. So just keep it in your mind or consider it with your team when you are assessing the patient. If the patient need on ventilator. Providing the daily sedation and assessment for readiness to extubate by limiting sedation drug or holding when the patient is improving and ready to allow the patient to awaken fully. So it's really important to adhere to sedation vacation, which has a direct positive impact on reducing patient average duration of the mechanical ventilation and reducing patient length of stay in the hospital. Peptic ulcer disease is the most common cause of the gastrointestinal bleeding in ICU patient due to ulceration by rising the gastric pH level, then allow the bacteria overgrow. So applying peptic ulcer prophylaxis is a necessary intervention to prevent valve. Provide a DVT prophylaxis unless there is a contraindication to prevent the other serious complication that could increase the mortality and morbidity. We should do a daily oral care with chlorhexidine every 4 hours to remove dental blood. Regular inspection of mouth is important and should report any redness, bleeding, tenderness, or sores on the lips or in the mouth in order to reduce the incidence of valve. Other basic prevention practice, cleaning and disinfection of respiratory care devices is very important. Hand hygiene before and after contact with the mechanical ventilation or with the ventilator equipment, and use gloves, using clean gloves and face shield mask during suctioning, and discard use suctioning catheter. We should frequent suctioning of oral, pharyngeal, and tracheal secretion for preventing aspiration. We should, when soiling with a respiratory secretion from a patient is anticipated, wear a gown and change it after soiling occurs and before providing care to other patients. This is the form of ventilator bundle for daily review and assessment. Surgical site infection is a major problem in the surgical practice that occurs after surgery in the part of the body where the surgery took place within 30 days after operation. SSI is diagnosed with the clinical sign of infection, fever, skin rash, and localized pain or pus, and discharge from the wound. And also, when there is a laboratory confirmed disinfection from the wound swab culture where it take from the wound site, and alongside with the blood test and blood culture if there is any evidence of sepsis. Bundle approach to prevent SSI, clipping body hair instead of shaving it, adequate antibiotic prophylaxis, maintaining the patient body temperature, and controlling blood sugar. All of these can be summed up with the acronym CAT, represented by the image of this animal. We should stop the use of razor to remove or shave patient their hair and use only hair clippers or surgical clippers. Do not remove hair before surgery unless the hair at or around the incision site will interfere with the operation. If the hair is to be removed, remove it immediately before the operation within 2 hours as recommended to minimize the potential for contamination of sterile field or surgical wound. Antimicrobial prophylaxis. The purpose of antimicrobial prophylaxis to prevent the infection when the infection is not present, but the risk of post-operative infection is present. So we should administer a pre-operative prophylaxis antibiotic when indicated. The initial dose should be when the incision is made approximately 30 minutes to 1 hour before skin incision. If vancomycin or ciprofloxacin is used, then the infusion should begin 60 to 120 minutes before the incision. All antibiotic administration must be completed at the time of the surgical incision. For high-risk cesarean section, administer the antibiotic immediately after the umbilical cord is clamped. Discontinuing the antibiotic within 24 hours after surgery, except the cardiovascular surgery, antibiotic should be discontinued within 48 after surgery. The purpose for temperature monitoring is to detect thermal disturbance and maintain appropriate body temperature during anesthesia. Because the drug that used for anesthesia is cause a hypothermia, so that can be lead to potential dangerous health heart problem and maybe cardiac arrest. So it's very important the temperature should be measured for more than 30 minutes after induction of anesthesia and should be maintained above 35.5 to 36 during the preoperative period. Diabetic mellitus has been recognized as a risk of factor for SSI because the anesthesia always puts stress on the body, which lead to the elevate or increase blood sugar level. So we should adequate and control blood sugar in all diabetic patients, and particularly avoid hyperglycemia preoperatively. Other basic prevention practice: we should keep pre-operative hospital stay as short as possible, while allowing for adequate pre-operative operation of the patient. Whenever possible, identify and treat all infection remote to the surgical site before elective operation, and postpone elective operation on a patient with the remote site infections until the infection has resolved. We should instruct our patient to shower or bath with antiseptic agent on at least the night before the operative day. We should completely wash and clean at and around the incision site to remove the cross-contamination before performing antiseptic skin preparation. This is the form of surgical site bundle and event form that the first part is to be filled by a nurse, and when there is SSI event should be in the bottom here, it will be filled by physician. So why should we care about the healthcare associated infection and any infection? We all have been taught that as a healthcare worker, we first do no harm. So everyone working in the hospital, regardless his or her job, should follow this advice. So we must not harm our patient or other with not following or not complying with infection control measures. Finally, remember, implementation of invasive devices, insertion and maintenance bundle are the most effective way to reduce the incidence of CLABSI, CAUTI, VAD, and SSI in ICU and in non-ICU settings. Thank you so much for your attending, and for any question, feel free to ask. Or this policy, you can find it in the infection control files in the hospital data for anyone who want to go back and read or get more information. Any question? Let's go ahead. You don't have? Okay, we have a challenge in our hospital actually. Some supply is not available, so I know, I understand.